Firstly, I'd just really like to welcome everyone to this Workplace Health for You webinar. Here's an agenda for today's session. Rough kind of timings, I think we'll run through about half an hour, 35 minutes, and then leave plenty of time at the end for questions. With that in mind, it might just be easier if we can kind of keep hold of those questions and ask them at the end. That would be fantastic. We are actually recording the meeting. A number of people have actually requested that they have that and can access that afterwards, and we hope to get that link out in the next few days. No requirement to have your cameras on, that's fine. I think our excellent Debs is running the show behind the scenes and has control of mics and whatnot. So hopefully shouldn't be any disturbances. Famous last words. We will move on. As I said, my name's Guy Sharp. I work in public health here at Wiltshire Council, and I'm kind of the programme lead for our workplace health programme. I'm going to hand you over to Helen to introduce herself.
Oh, hello, thank you, Guy, and welcome everybody, and thank you so much for coming along today. So my name is Helen Nichol. I support Guy with the workplace health agenda. It's a fabulous area to work in, and we're really looking forward to meeting you all and hearing about what you need from us as well. So I'm just going to hand to my colleague Hannah.
Thanks, Ellen. Hello, everyone. I'm Hannah. I'm one of the health improvement coaches at Wiltshire Council. Predominantly, I work one-to-one with clients, and part of my role is with workplace health with Helen and Guy and our lovely Debs as well, who helps us out so much. So, yeah, that's me. So on to you, Debs.
Oh, thanks, Hannah. Hi, I'm Debs, or Deborah, or Debbie, whichever you want to call me. I'm a project officer for Wiltshire Public Health and look at communications and other projects. Thanks.
Brilliant. So if we, just really want to touch on here why workplace health and well-being matter, essentially the reason we're here today, and you're giving up your time. So we know that in recent years the emphasis on health and well-being in the workplace has gained significant momentum. This is a shift that reflects a broader understanding of employee health. Employee health impacts not only individual performance but actually the overall success of an organisation. The increasing focus on workplace well-being can be attributed to several key factors, and I think that first point there, a healthy workforce is a productive workforce, and I think that's coming more to the fore through recent news around economic prosperity. We also know that improved employee retention and satisfaction comes as a result of investing in workplace health. So programs that promote physical health and mental well-being and work-life balance can lead to higher job satisfaction and loyalty, can reduce turnover rates and the associated costs of recruiting and training new staff. There's also the issue around an enhanced corporate reputation. I think that's more of an issue these days. So companies that prioritise employee health and well-being often enjoy a better corporate reputation. And actually people really value that, certainly when they're looking for businesses to engage with. There is a growing mental health crisis. I think we understand that, certainly in public health and as business owners, employers, employees. I think maybe you're seeing that in your workforce. So again, investing in workplace health really kind of shows that you're interested in that and really value your staff. So on to the next slide, if we might, Debs. So I just wanted to touch briefly on legislation and policy. It's not necessarily the remit of public health. We're more of a kind of a prevention and early intervention service, but I think it would be remiss not to mention that. As employers and as employees, you have a responsibility for the health and well-being of your employees or yourself. So beyond the practical benefits, it's those legal and ethical considerations that drive a focus on workplace health and well-being. We have those big government organisations and our local authority environmental health department that have a workplace kind of health and safety focus and kind of enforcement role. And as I said, that's not where we operate. We're kind of prevention, early intervention. That's kind of supporting the workforce as a whole. That's really where we come into it. But I think, you know, it's understanding that there is legislation out there. So things like the Equality Act 2010, the Health and Safety at Work Act 1974, and the Management of Health and Safety at Work Regs 1999 are kind of very important bits of legislation to be aware of if you're not already, and I suspect you will be. But, you know, as part of this kind of discussion, it's worth noting that, and we can certainly send you links to kind of the support that is out there on and around this subject. So that's enough around legislation and policy. It's really more about what we can offer you as a service. So I'm going to hand over to Helen and Hannah to go through the support that we can offer you.
So I'm going to just say we're at the start of our journey. So we have been developing offers for workplaces, but what is really important is today we are also going to ask you what you need. And as we go on, continue with this journey, we hope that we will be developing those offers that will really benefit you and your staff the most. So you can see the little sign up there. We're going to give you lots of links so that you'll know how to contact us, but please do contact us. Do contact our team if you need help. But at the moment, what we do have available for you are a number of pages on the Enterprise Network website. So that is the Business Network website. All things health and well-being you will find there. So they're trusted sources, links to information and support that is free of charge. So we've tried to make sure they are free of charge. That does not reflect on the quality of that support. In many cases, it is the recognition that by keeping our workforces healthy, actually workplaces prosper, businesses prosper, the economy prospers, and really most importantly, individuals get to live, you know, their best life. But what we are really excited to mention is that we are working together with partners. Those are including Help Counselling, Wiltshire Mind, the Wiltshire Wildlife Trust, and Open Minds to offer you access to mental health first aid training, awareness training, and champion training. The counselling offer is also available. So that is direct access to counselling for individuals to help them with low levels of mental distress, but maybe where they're waiting for services from their GP, for example. But this actually provides one-to-one support for people and really, really quickly. So we're absolutely delighted to offer those services. There will be links at the end so you can go direct to those providers, find out what they're offering and how you can access that. I'm going to hand over to Hannah in just one moment because she's going to talk more about our health coaching offer, which is access to professional health coaches. But I just wanted to show you that picture where we all look a little bit like aliens, I'm feeling, which was a site visit to Bakkavor, which is a large dessert production factory and devices, and we were delighted to be able to go along and actually visit them, see what they're doing to support the health and well-being of their workforce, and look at what we could do to actually complement them. So I'm going to hand you to Hannah because she can talk a little bit more about how that looks.
Thanks, Helen. Hello, everybody. And again, just echoing, thank you so much for all of you joining us. So yeah, I'm Hannah. I'm one of the health improvement coaches at Wiltshire Council, as I mentioned earlier. Predominantly, I work on a one-to-one basis with clients across Wiltshire. So that's supporting them to improve their wellbeing needs, That includes weight management, physical activity, emotional well-being, smoking cessation, and reducing alcohol. So as a part of health improvement, we know that there are gaps in which some individuals find it harder to access health services, like what we as health improvement can provide them. There are many factors that can impact this. So as workplace health, one of the factors that we want to target are routine and manual workers. So with what we're doing here with workplace health, we're targeting that demographic in order for them to still have the same access to the services that we can provide. This can also prevent intervention later on down the line from, say, services like the NHS or what have you. So yeah, I just wanted to share a quick case study with you all. So we've got this gentleman here. So he's called John. He's 54. He works shift patterns at a local factory. He does some night shifts, overtime, but mostly is daytime shift 10 till 6. Lived in Trowbridge in the local area for all of his life. Married for 30 years and worked in this factory for over 25 years. So he's a long timer there. Same routine, day in, day out, week-wise, he does the same thing. He's a long-time smoker, not really thought about quitting. Weight's been on his mind in terms of weight management and losing weight, but he's not really sure where or how to start addressing that. So we've gone in and we've done a little mini health event at his workplace. He's popped along after a shift, and we've just done a quick blood pressure check. Blood pressure is slightly higher than what we would like, and what is, we want to make sure that you bang on. So it was slightly higher, which was a surprise to him because he's not had his blood pressure taken for a long old time, a real long time. So I signposted him to his GP to get this checked further, which he has done. We also discussed his smoking, and he said that he's always been a smoker, which is normally, it's just the norm for him. He's done it since he was a teenager. So very typically long-term smokers, they've been doing it since they were teenagers. But he says it would be nice to have a bit more money in the bank, but not really sure if he feels like he could do it. So with the support that we provided, one-to-one session, giving him that support over a 12-week period, we provide nicotine replacement therapy and the behaviour change as well. And I'm happy to say that he is smoke-free and has been for the last 3 months since his 12-week plan, which is fantastic. And he said that it was a lot easier to be able to attend these sessions in the workplace than being able to do it outside, whether that's motivation to do it outside or whether that's, just not having the time to do it and being able to fit into our, the normal 9 to 5. And he's done really, really well. So we supplied that. He's, like I said, smoke-free. On top of this as well, we found, he's got more money. He's able to treat himself a bit more and his wife. We addressed the alcohol and found that, smoking increased when he was drinking alcohol. And since quitting smoking, his alcohol was significantly, that was a bit of a hard word then, significantly lowered, which, again, is fantastic. And then from a follow-up, he's lost a couple of stone. Well, he's lost 2 stone, and he's also gone to his GP to discuss his blood pressure, and it was higher than average. And he's been put on medication to make sure it was managed. So it just sort of goes to show those people that we don't normally get with just doing our normal work, and them having to self-refer or hope that they go to a GP and come to us. The changes that we've made for this particular gentleman, it's invaluable, really, and it reaches those routine and manual workers who find it harder to access our service. So yeah, great, and I just hope that we can do as much as we can for all of you guys as well. So yeah, so thank you very much. That was my spiel. So there we go.
Apologies, had to be a mic on moment there, didn't I? So thank you so much, Hannah. And really what that brings me on to are some of those top tips that we mentioned earlier. You will all have your own top tips, and you will all probably be doing this already. So this is just really a reminder, but I mean, any workplace, if it's a really tiny one, it may be that you're even working on your own. Leadership commitment is really high on the list. So that's all around that self-care. It's around modeling the behavior that you would like to see other people really take as well. So we always say this self-care is not selfish care, but that leadership commitment, I mean, in bigger organizations, that may well be policies, it may well be all manner of interventions, but you can start really small on that, and just starting, as I said, with yourself and modeling that behavior can really make a difference. You often think that your employees don't listen to you. I can promise you they really do. Open communication, this is just so key, and I think if you do nothing else, this can just be a game changer. So talking about health, be it mental health or physical health, as just a natural and everyday occurrence, bringing it into conversations, just bashing down those stigmatizing barriers, it can really give you as a manager especially that opportunity to notice if there's a change in a person. So do talk about these things. Please invite us along. We're more than happy to speak to your workforce and get that conversation started. Providing access to health resources. So we've already mentioned our website, lots of information and resources there that are available to you. As Hannah's just explained, we have health coaches that can come along. They can work with individuals, they can work with groups on all aspects of a person's health, including helping them to quit smoking, for example, or maybe to reduce weight. And it's amazing how this can have a ripple effect. So, one or two people may be interested, and then suddenly it becomes a buzz. And what we're finding is that where this happens, people are sustaining work, they're not going off sick so often, and actually they're being more engaged, and that real team aspect is coming into those workplaces. Flexible working arrangements. Well, this is not as easy for some businesses as others. Some places it's very easy to offer things like home working, flexible start and finish times. We really understand that that doesn't work for everybody, but there can be really simple tweaks. So they can just be making it easy to have a medical appointment in work time, for example, especially because it can be so difficult. It can be respecting life events, so that may be sadly a bereavement, for example. If there's any little aspects, it may be changing shifts, it may just be allowing slightly later or earlier finishing times. Creating that supportive environment. So that can be the physical environment, having somewhere that people can go away and rest and have a break, and that just in that area having access to resources that will support their health and well-being. But that supportive environment may also be accessing some of those services I mentioned, for example, the counselling services, having those leaflets available, and we can certainly supply you with those. I'm in education and training, so I've mentioned the offers around the mental health first aid training, awareness and champion training, skilling up your managers, skilling your workforce so that they can just start a conversation. This isn't about anybody being an expert. This is about just getting a conversation started and feeling really confident about where you can signpost a person for support. So if we just pop on to the next slide. And so just some of those quick wins, how we can, just maybe get the ball rolling here. And I don't think you can do anything better than starting a conversation, asking your workforce what would really work for them, what are their needs. You can be realistic. We can't all go on a lovely holiday. We can't all say, can I have, 2 months paid leave? Those things are not open. So set some parameters, but it will be amazing when you really start those conversations. Sometimes it's really tiny things that can make all of the difference. Please do access our resources. Please visit our website. Please feed back to us on what you need. Do access that direct support, potentially the counselling offer or those training offers. And really that learning and development is just so key, and especially if you can focus that with your managers and trickle that further down. There are also on our website other learning and development opportunities. Wherever possible, they are free of charge. And we're also looking at developing some more support for you as well. So thank you very much. I'm now going to pass you back to Guy.
Brilliant. Thank you, Helen. Thank you, Hannah, and thanks, Debs, as well. So we've kind of really rattled through that, actually. You know, all these best laid plans, and I think everyone's speeded up for the occasion. So actually, we're at that point now where we certainly welcome your questions. As Helen has mentioned, we feel that we've got a good offer for you. It's an offer that's building, but what we're really interested to hear is your views. You know, what works, what doesn't work, you know, how we can best engage with you. You know, it would be really interesting to hear maybe your thoughts on kind of those communication channels, you know, and how we get that message out there, certainly with the services that we look to develop over time, and just generally what you think. So I will open it out to the floor. If anyone has any questions, we will certainly do our best to answer those, and if we don't, what we can do is certainly follow up. So if you leave your email address or telephone number, we'll definitely kind of be in contact. And actually that's an open invitation anyway, just to discuss our kind of workplace health offer. So
Thanks,
yeah.
Phil.
Yeah, brilliant. Thanks,
Right,
Deb.
we have got a few questions that have come in on email in advance of the webinar. The first one, obviously, we have sort of addressed, but we'll address it again, was how do we access this support?
So my first suggestion on that front would certainly be to use the workplace health website pages. So that's on the Enterprise Network website, which is actually a website run by our colleagues in economic development. It's an external website, and Helen has very kindly shared a link I can see in the chat. So that has a whole wealth of information on general workplace health, and then the different areas of workplace health, and we signpost to those offers that Helen's talked about. So I think initially that would be my first response, and on there as well are our contact details. So the generic contact email address is publichealth@wiltshire.gov.uk, and I think hopefully, Debs, you might be able to share our telephone number as well, so you can always leave a message on there, and we will get back to you as soon as we possibly can, just to follow up.
Okay, yes, the telephone number is 0300 003 4566. Okay, the next question was, how much does any of this cost?
So thanks, Debs, for that question. So I can tell you that everything that we signpost to, and certainly the offers around counselling and the mental health first aid training, they're actually free. So they are offers that have come through pots of money that we look at. So those kind of counselling and mental health first aid courses are actually funded by the UK Shared Prosperity Fund. So working with colleagues in economic development, we've managed to provide a number of subsidised places which are free. So again, go through the website and follow up either with us or individual providers where necessary. But yeah, the funding for this is from central government, because we very much operate in this prevention and early intervention space. That's really where we look to operate, and that comes down through a public health grant, and that's where we're kind of looking to support you as employers and employees out in the Wiltshire public.
Thanks, Guy. Another one was, I used to work for a large corporate. Is your service similar to occupational health?
Thanks, Debs. That's an interesting one. So we aren't an occupational health provider or service. That's not really, again, the space that we operate in. I mean, there might be elements that would be similar. So again, the counselling offer might be something that you would get through an occupational health team, but we kind of managed to secure that opportunity for certainly for smaller businesses, because we know that you don't have that capacity or the funds to be able to kind of access occupational health support. There are kind of ongoing conversations around what that might look like, and there was a recent sort of national kind of consultation on that issue. But no, this isn't an occupational health service. We can sort of signpost, I believe we do on our website, and also I know that the Health and Safety Executive also have a page where you can actually access local occupational health providers. But yeah, as prevention and early intervention kind of specialists, we're, I guess, maybe a wider kind of remit that we're operating in. Thank you.
Okay. Sue has asked, how does she get in touch to obtain the leaflets you discussed, please, Helen?
Hello, and thank you, Sue. I've just popped a little note in the chat there. Just send a request to Public Health, just say workplace health leaflets, and I will send you over a batch. I'd be delighted to do that.
Okay, thank you. And Sylvia's asked, is there anything in place when we as an employer offer counselling through this service and things go spectacularly wrong for that individual?
So the counselling offer that's provided is through trained professionals. So Wiltshire Mind and Help Counselling are the two providers. So they are fully regulated counselling services. So when you look to kind of either self-refer or possibly look at an opportunity to discuss your business needs with either of those organisations, depending on your need, there will be an element of triage. So they will look at individual cases to make sure that counselling and the type of counselling that's being offered is right for those employees. So yeah, that would be my reassurance, that they're fully regulated, and all the counsellors used are professionals and should be able to manage that kind of process and understanding.
Okay, thanks, Guy. One other question is, can you come out to our workplace?
The simple answer to that is yes. If you are operating in Wiltshire, we would be absolutely delighted to just come out and see you and have a discussion around kind of what your workplace health needs might be. Now we can either kind of visit your workplace, and again, that's not a problem at all. We can have a phone call, we can have a Teams message, but it's we want to engage with you. We want to understand, you know, what the needs are of your organization. You know, as an employer, whether you've got issues perhaps around smoking in the workforce, and you're sort of noticing quite high rates of staff sickness related to kind of respiratory illnesses. So it's very much having that conversation, understanding what those workplace health needs are, and then seeing what we can do to support you. But yeah, we're absolutely happy to come and meet you, and work with you to really kind of support.
Okay, Sylvia's just come back saying, what if that triage fails? Where do we take it next? Can we contact you directly rather than via generic email address?
I mean, because there's multiple people, I guess, working on this program, the public health kind of email address would be my recommendation. I mean, ultimately, if you've got concerns around employees, then I think the GP route is kind of the first priority. I think the counselling offer is for low-level mental health support, so those people that might just be starting to struggle and might drop out of the workforce. And as I said, they might, you know, that triage with either Wiltshire Mind or Help Counselling would best deal with that. But if you as an employer have real concerns around the kind of mental health or health of your employee, then I would certainly signpost them to make contact with their GP. On our website, there is actually a kind of an urgent support page as well, which does list other sources of information that might be relevant. depending on the circumstances. But yeah, first and foremost, if you're concerned, then I would contact the GP or get the person to contact their GP.
Great, thanks, Guy. One other question that's come in is about, can you help us with infection prevention control and winter vaccinations?
Absolutely. So, as a recent example that Helen's just talked about, the local food manufacturer vaccine uptake is an issue there. They have a routine and manual workforce that don't necessarily want to engage with health services. So we can bring out information around infection prevention and control measures, and also those signposting opportunities, and really kind of that public health messaging about the importance of vaccination. So yeah, we don't work in a silo in public health. We're working with Hannah and the health coach team to offer that kind of behavior change support. But yeah, we also have our health protection team, so they do outreach, and they, I'm sure, would be more than happy to kind of engage or provide us with that information that we can pass on. So yeah, we just don't work in isolation. It all depends on that business need.
Okay, thanks, Guy. Sue's just asked, you've mentioned about mental health first aid training. Do you offer refresher and update training too?
So unfortunately, I don't think that's the case. I think the way that the funding has been secured, I think it is that first time initial mental health first aid training. I think there is mental health first aid training. I think there is champion training and awareness training, but I don't think we're operating that refresher training. What I would say though is it might be worth just reaching out to those organisations that are offering that. So again, Wiltshire Mind, Wiltshire Wildlife Trust, Open Minds, and having that conversation. I think it's definitely worth pursuing and seeing what options are available to you.
Great, thanks, Guy. Another question in from Grace. Do the staff need to be Wiltshire based also? We're based in Salisbury and some staff travel from Hampshire.
That's fine. And part of health improvement coaches with the workplace health is absolutely fine. We can work with people that are across the board and what have you, so that's fine.
Yeah, I think that's a very important point, actually, Hannah. Ultimately, it's about the health of the population. I appreciate that, local authorities are kind of boundaried organisations, but we're in it together. I think we need to support the residents of Swindon, or like you say, Hampshire. So there are arrangements in place where we can support, and certainly something like Stop Smoking. I know there are reciprocal arrangements that work, and that we can support that. So yeah, that shouldn't be a barrier. I think definitely let's have that conversation. Most definitely.
Thank you. Yeah, that's good that you mentioned Swindon, because Gillian had just popped in. Oh yes, we've got Swindon. Is that under you or under Swindon Council?
Yeah. I mean, we work together. It might not always seem to be the case, but actually when it comes to public health, as I said, we're all in this together. And yes, we understand that a workforce doesn't just live and work in the same area, that people will come in from other areas. So yeah, I think we certainly want to help as many people as possible with our offers, with what we can help. So yes, please don't be too concerned if your workforce or some of your workforce live outside the area.
I've also had another one come in about employees where English isn't their first language. Do we have resources that we can help with that?
So this has been an issue that has been raised, and in some instances I think there are kind of resources that we can offer, certainly translated kind of leaflets and things like that, where we're having kind of that kind of health fair type set up. We do offer that. I think some of these are national resources. It is a challenging area, as an employer, I would expect there to be some level of kind of support for getting out information to different nationalities. But again, it shouldn't be a barrier, and I think that's a discussion that we can have and look to see what we can do. I mean, obviously we're not a translation service, but you know, no barrier. Let's try and work over that. If that is an issue for you, just give us a call and we can follow that up.
Yeah, I concur, Guy. From looking at the comms side of things, I can download and access multiple language leaflets from the NHS, etc. So if anybody does need anything in a different language, if they can pop us an email, then we can order those for you and get those delivered.
Brilliant, thank you, Debs.
Right, that's it for my questions that I've had in, unless anybody else has got anything. I can, oh, Richard's put his hand up. Bear with me while I sort out the audio settings and lift the mics. I'm saying that. Typically, I can't find the right button at the moment. It's disappeared on me. Hannah, you had it earlier, didn't you?
Let me have a go.
Hi,
Right,
Richard.
now,
Yeah.
Mike. That should do it now.
Oh.
You should be able to take your mic off.
Oh, it's still on at the moment, Richard.
Oh,
You're still on. You're still on mute, love.
No, it's not working, is it? Sorry, Richard.
Pop it in the chat if anything.
Yeah, Richard, I recognise your face. You're from the livestock, or the livestock auctioneers. Yeah. So unfortunately we can't hear you, Richard. It's really quite frustrating. But I have your email address. So hopefully, and certainly Sue's email address, so we can follow up perhaps outside of this meeting, if that works for you. If you want to give me a thumbs up, perhaps. Brilliant. Sorry about that. Technology.
Joys of technology, eh?
Absolutely. Brilliant. All right. Now we'll follow up with that, Richard. Thank you. So that was probably going to scare anyone else trying to come off mic, but yeah, apologies for that, Richard. Perhaps any other questions might be better in the chat. That would be yeah, the best way. If not, then all I can sort of say is really thank you for joining us today. Thank you for your time. Really appreciate, you know, time is limited these days, but I'm hoping that there's something in there that's just sparked a bit of interest, and please do reach out and speak to us, and we will follow up and we will contact you and discuss your workplace health needs. And where we can support you, we will do everything. Like I said before, we'll come out and see you. We can set up a Teams call, a normal telephone chat. Richard, I will email you, I promise. And yeah, you know, public health at wiltshire.gov.uk, or certainly the Enterprise Network website, if you can. There's a whole wealth of information there. And if there's anything that you think perhaps we're missing, or ways that we can get our messages out there, please do let us know. We're always really interested in any sort of feedback, positive or negative. I think it all helps, and I really appreciate your time today. And as mentioned, we will send out a recording for anyone that's missed it, or if you want to forward it on to anyone that you think might be interested. And thank you to all my presenters as well. Very much appreciate your time.
Also, just to add, sorry, Guy, just to add to that, if you've got anyone that you can share this with as well, so any partners that anybody works with that think they could benefit, please do share on, and we'll be here to help out where we can.
Yeah, thanks everybody. And also just to say that we will be having a regular column in the Business Exchange Wiltshire magazine for next year. So if there's any topics you want us to specifically cover, then obviously, again, drop us an email or reach out to us on any of our social medias, and we'll try and get that included.
Brilliant. So thank you, everyone.
Thank you.
Yeah, enjoy the rest of your day. Bye.
Thank you. Bye-bye.
Bye.